You eat your eggs every morning. You take your protein. You even added salmon to your meals after watching my last video. But by afternoon, your legs still feel heavy. Getting up from the chair still takes more effort than it used to. And no matter how much you rest, that tired feeling is just always there. Here is the part that most people miss. The problem might not be what you are eating. It might be what your body is no longer able to use the way it once did. And one vitamin that many people over 60 are running low on sits right at the center of that problem. I am Dr. William Harris, and today I am going to share 3 warning signs that your vitamin D may be too low right now. Not the kind of signs doctors always catch on a routine visit. The quiet ones. The ones you might be brushing off as just getting older. Let me tell you about Barbara. She is 71 years old. She lives in Ohio. And she was doing everything right. Walking every morning. Eating protein at every meal. Taking a multivitamin. Her doctor said her labs looked fine. But Barbara kept saying the same thing. I don't understand it, doctor. I'm doing everything right. Why do I still feel this way? Her legs felt heavy most afternoons. She needed more time to recover after her morning walks than she used to. And no matter how many hours she slept, she woke up feeling like she had not really rested. When we looked more closely, her vitamin D level came back at 18 nanograms per milliliter. The general range on most lab reports shows anything above 20 as acceptable. But for someone over 60 who wants to stay active and strong, 18 is not enough. Most research suggests that adults over 60 do better with levels between 40 and 60 nanograms per milliliter. Here is something that surprised Barbara, and it surprises a lot of my patients. She thought vitamin D was mainly for bones. And yes, that is true. But there is something else vitamin D does that most people never hear about. Here is something most people never hear. Your muscles do not just need protein. They also need the signal that tells them what to do with it. Think of it like a lock on a door. Vitamin D is the key. When the key is present and the lock opens, your muscle cells receive a signal. That signal tells them to take in protein and use it to rebuild and repair. When vitamin D is low, the key is missing. The protein you eat sits outside, waiting. The door stays closed. Your muscles cannot use what you are giving them. For Barbara, she was not short on protein. She was short on the vitamin that allowed her muscles to use it. And this is exactly why I told you at the end of the last video to pay attention to this one. So how do you know if your vitamin D might be low right now? Here are 3 signs I see again and again in my patients over 60. The first sign is legs that feel heavy and slow, even after you have rested. Not painful like arthritis, just heavy. You are not in pain. You just feel slower than you used to. You stand up, and your legs feel like they need a few extra seconds to wake up. You climb stairs that used to feel easy, and now they take more out of you. This happens because when vitamin D is low, the muscle cells cannot produce enough energy at the cellular level. Think of it like a car with a good engine, good tires, and a full tank of gas. But the spark plug is missing. Everything is there, but the engine will not turn over the way it should. The second sign is fatigue that does not go away after sleep. This is the one that frustrates people most, because they do everything right. They go to bed early, they sleep 7 or 8 hours, and they still wake up feeling like they never rested. Here is the surprising part. Think about it this way. Your body can only use the energy it is able to produce, and vitamin D plays a bigger role in that process than most people realize. These are the tiny structures that turn the food you eat into energy your body can actually use. When vitamin D is low, mitochondria slow down, and when mitochondria slow down, it does not matter how much you sleep. Your body is not recharging the way it should. There is also something worth mentioning here. If you have been taking your vitamin D3 in the evening, that timing may be quietly working against you. Vitamin D3 has a gentle, alerting quality. It nudges your system toward being more awake and active. When you take it at night, it can get in the way of melatonin, the hormone your body needs to settle into deep sleep. They do not cancel each other out completely, but they create a kind of interference. Your sleep may feel long enough, but not truly restful. I will come back to this in a moment with the simple fix. The third sign is soreness and slow recovery after light activity. If you take a 20-minute walk and your legs need 2 or 3 days to feel normal again, that is not just aging. Vitamin D helps regulate the inflammation process inside muscle tissue. When levels are low, that inflammation after activity lingers longer than it should. You wake up stiff, your thighs ache, your lower back feels tight, and you start avoiding the walks that would actually help you, because your body is not recovering the way it once did. Barbara recognized all 3 signs when I described them. She had been living with all of them for over a year, assuming it was just what getting older felt like. It does not have to feel that way. Now let me explain why people over 60 are more likely to have low vitamin D, even when they try to do the right things. Here is the deal. After 60, 3 things change at the same time. First, your skin produces less vitamin D from sunlight. A younger person and an older person can spend the same 20 minutes outside in the sun and end up with very different amounts of vitamin D. Research suggests that older skin can produce significantly less vitamin D from the same sun exposure. Second, vitamin D needs to travel through the liver and then through the kidneys to become the active form your body can actually use. After 60, the kidneys slow down this conversion process. So even if you are taking a supplement, less of it reaches the active form. Third, D3 is a fat-soluble vitamin, which means it needs fat and stomach acid to be properly absorbed. After 60, stomach acid tends to decrease, and if you are taking your supplement on an empty stomach or with a fat-free meal, a significant portion of it may pass through without being absorbed at all. 3 factors working against you at the same time. That is why so many people over 60 are low, even when they think they are covered. Here is what I recommend, and please do discuss this with your own doctor before making any changes. First, ask your doctor for a simple blood test called a 25-hydroxyvitamin D test. This is the right test for this. A level between 40 and 60 nanograms per milliliter is generally considered optimal for older adults who want to stay active. If you are below 30, it is worth addressing. Second, if you are supplementing, take your vitamin D3 in the morning with breakfast, not in the evening. Morning is when your body expects the alerting signal, and it fits your natural daily rhythm. And have some real fat with that meal. Eggs, a little yogurt, some nuts, a small amount of butter. Fat is what opens the door for vitamin D3 to be absorbed properly. For most people over 60, a maintenance dose of 1000 to 2000 IU daily is a reasonable starting point, but please do not increase beyond that without first testing your levels. Vitamin D3 builds up in the body over time, and too much is not without risk. After a few months of consistent supplementation, it is worth checking your levels again to see where you land. Barbara made these adjustments. She moved her D3 to the morning with a breakfast that included eggs and a small amount of butter. After about 6 weeks, she noticed a shift. Her legs felt lighter. Her morning walks stopped leaving her sore for days. And for the first time in over a year, she started waking up feeling like she had actually slept. Your body is not too old to respond. It just needs the right conditions. Now, here is something important I want you to know. Before you start increasing your vitamin D3, when D3 rises in the body, it helps pull calcium into the bloodstream. And calcium is good, but only when it goes where it is supposed to go. There is a partner vitamin that helps direct that calcium into your bones, rather than into places you do not want it. And in the next video, I am going to show you exactly how D3 and that partner work together, why the timing matters, and the 3 signs that tell you they may not be absorbing properly in your body right now. If you found this helpful, please like this video, subscribe, and share it with someone you know who has been feeling tired or struggling with weak legs. Sometimes the answer is simpler than we think. This is for educational purposes only, not medical advice. Always consult your healthcare provider before making changes, especially if you take blood thinners or have a history of kidney disease. I am Dr. William Harris, reminding you, we cannot always control aging, but we can absolutely shape the way we live through it. Stay strong, stay aware, and I will see you in the next video.